Hey, there we are.
Charlie,
Yep.
we're live, Charlie.
Yes, we are. Aloha, everyone. Happy Aloha Friday.
Aloha Friday, everybody.
Yeah.
You know what really confuses everybody, I think, because before I started putting dates on the post, they don't know if they're watching a live post or a live or a replay, and we're telling Aloha Friday. They must freak everybody out, man.
Now it's Wednesday, ladies and gentlemen. It's June 10th, and you're on this format with Mel and Charlie live on Facebook Live. And so we're so happy to have you all join us tonight. And we got some good news. We got some good
Good
news
news.
for you today. I wanted to let all of you folks know that I just took a nice hot shower. That's the good news. And I feel
Well,
good.
we tonight we have some mean competition tonight, Charlie.
Yeah,
Um,
I guess so. Yeah.
yes, Tom, this is live, baby. He goes, what? Wait, is this live? Oh man. No, we have some mean competition tonight. We have a candidate forum going on right now. It's on Facebook. It's actually on TV as well. Patsy and I were watching it, and let me just explain. Um, we we go out and find speakers for you all. We find guests. Some of them are very very hard to pin down to a date. And Dr. Trpkovsky, who many of you know, well, he was a doctor here in Kauai. We respect all of their time. So we booked him before we knew about the forum. And had we known, of course, we would have kept tonight open. Actually, Charlie, I would have played the forum on our show and watch it with everybody. But unfortunately, we couldn't move Dr. T, and so we're hoping that you watch the forum either live or recorded, and we hope you watch us either live or recorded. Tonight's, I think, going to be a pretty explosive show. I think Dr. T, as you see him on TV, he's a kind of animated guy, and I have never met him. I think I did while he was. I got to ask him if he was an ER doctor because I swear he helped treat my mom once or twice. But I'll ask him tonight. But I know many of you have posted that he was your doctor, so I'm hoping that where is the debate? The debate, it's not a debate, it's a forum, and it's on Facebook Live I forget what page it is on, but it's also on channel 53, I believe. Not that I want you guys to leave us, but it's being broadcast on channel 53 on Hawaii. So again, I think everybody should be educated about the candidates. And for those of you that are with us tonight, Charlie and I decided that starting on the 22nd, we
Mhm.
will be having candidates on. We're going to have 4 candidates per night, 15 minutes apiece. So far, I've had responses from 4. So we got the first night covered. We're hoping to get the rest on, and I'm assuming they all will at some point come on. But from the 22nd to the 27th, obviously, if we get all the candidates to come on, and basically 10 minutes, they get to sell themselves, and then 5 minutes of hell with Charlie and Mel. So it's gonna be exciting. We'll field your questions as well, and this is just the first of many. After the primary, when we narrow it down to the final 14, then we'll have some forums as well. So I just want everybody to know that we are very serious about informing and educating, and we believe that the elections that are coming up, and we're starting with the council candidates, but we're gonna also have we have 2 contested House races as well. Nady Nakamura and D Morikawa both have. I'm sorry. Um, well, I think all 3 are contested.
Yeah,
No, yeah,
all
I
three.
think all 3 are contested. So we'll send out the invitation to them as well, and of course we'll update the COVID stuff as necessary. So we knew going in tonight was going to have a small viewership, but obviously many of you will be watching us on the replay. So the 22nd through the 27th, we'll have a candidate showcase, I guess, and we'll have some fun. And it's very important. This next election is a very important election. Remember, this group of council members are going to have to get us, along with the administration, through some very, very tough financial times. And so I'm
Mhm.
hoping that many of you tune in and learn, be educated. name recognition is one thing, but it's critical, especially now, that you get to know these candidates. They all have contact information. Get to know them, and vote as you see fit. Okay, we're not going to be endorsing. We're not going to be none of that stuff. We're just going to be putting them out there, asking important questions, and yep, popping my popcorn. Kimberly, all right. See that's what I love about this show, man. People they stop what they're doing, Charlie, to watch this show. And the last couple of weeks, few weeks, we've shared, Charlie, we've shared with each other about the comments that we get, the messages that we get. And what started off as a what the hell, let's give it a shot, turned out to be part of Kauai, and I'm super proud of it, man. And Charlie, I just thank you, man, because you.
Oh, thank you,
the
bro.
yin and the yin and the yang, man, and really, we don't plan on stopping this anytime soon, and we just hope that we provide the value.
Like I told you, we're like Captain Antonio, so.
Captain Antonio. Somebody posted today that we can go beat checkers and pogo, like the old checkers and pogo. And then someone else posted, well, who's going to wear the Palaka shirt? I mean, Charlie, really, who would be checkers and who would be pogo?
Well, I think I would be pogo.
No, I was thinking, I'm going to ask Charlie that question. And he's gonna say pogo. He's gonna say he's gonna be pogo just because he like debate. My uncle Ed, bless his soul. We pray for my uncle Ed. He's at the Mayo Clinic. He had throat cancer and just kind of spread out. He's going through a lot right now. But when he was a bank manager on Oahu, he lived in Kailua, and he lived right next to Checkers. It was right next to Mr. Checkers, man, the original, because they had I think they had two maybe afterwards, but I forget his name. You remember the original Checkers name? For the life of me, I can't remember.
Yeah.
What was his name?
His name was Chinese Checkers.
But it was so bizarre because as a little kid, I remember going to the Checkers and Pogo show. I remember going on an excursion once, and we went on the show, and I remember sticking my hand in the candy jar, the cookie jar, and dig out your pennies, put them in the Pogo Pog cap. You remember that? Mm-hmm. And we were so excited because, man, you all that money, but we were so young, and to see Checkers mowing his yard, to see Checkers without the Checkers clothes, but knowing that it was Checkers, and he was a really nice guy, and we spent our summers up in Kailua. And it was just what a treat to see Checkers being a human being. But maybe Checkers and Pogo is in our future, man. Hey, PBS, Channel 9, Channel 4.
We need to find somebody who can be our Professor Fun. Remember, Professor Fun was on with Checkers.
Oh! By the way, people, Dr. T will be on. We're just, we come on early. Usually we talk issues, but this I think is much more important. Professor Fun. Who would be, man, you know what? That glasses kind of looks like Professor Fun's glasses, bro, that you just put on. Let me see. Professor Fun. I don't know who would be Professor Fun. I'm trying to get some tips from maybe Kirk Correa.
Hey, did you send Dr. T the link and all that? To click on?
Yeah, I did. I hope I did.
He says, what do I need to do, Dr. T?
Oh my God. You sent me his thing, right?
Yep.
Okay, why don't you keep them amused while I find...
Ready.
Oh my God. See, we're getting complacent, bro. Oh, here we go. Dr. T.
Yep.
Okay, hold on. What the heck, man? I feel like really stupid right now.
No.
I guess I'll be Pogo.
Okay.
I guess I'll be Pogo.
Well, let me share with the people here. First of all, I'm kind of entering a code here for him, so we're gonna do it both ways. But I'd like to say aloha to all of you, and thank you again for joining us. We are so privileged, being here getting the message out. And our best is, because we getting ready to open up the state. We want to talk about it, and we think tonight's going to be a really strong night, like the night we had the other doctor, Daryl O'Carroll. And the reason being is that we know that they're working with COVID all the time. And what's kind of baffling is, remember, we went through a couple of weeks with, not so much for Kauai, but for the rest of the states, very low numbers, like either 0 or 1. Then all of a sudden, 2 days in a row, 9 and 9, and now 4. But yet, when it was low numbers, the state was closed. And now with high numbers, the state is opening. And I don't know if most of you had an opportunity, but if you do a little research, there's a group of people that the freedom, I guess they're asking for, attorney for freedom, something to that effect. But I just read about it. They filed a class action, looks like a class action lawsuit against the governor of the state of Hawaii. And I haven't read through it. It's a 170-page document, but it's real troubling. And it's they do what they want to do, So, but what I'm saying is, because of all of you folks out there, we've had the opportunity to bring the information to you. We'll keep on bringing the information to you, and we just can't thank you enough, because you folks have been very, very faithful, and we just thank you enough for allowing us into your schedule, especially an hour every night. And I know there's other things you can do. A lot of you have recorded us and play back later, but for the most part, we're just grateful. We're just grateful. And
Absolutely.
I'm looking forward to the many more things that we can share, because we will be transitioning. We'll be doing a little politics, and like Mel said, we talked about it, and definitely, we're not going to take sides. We'll just leave it up to you, the voters. That's what it's all about. And then after that, we'll probably transition over to businesses. We'll start promoting the different businesses on Kauai, and if you're on your island, whether it's a big island, Molokai, I know there's businesses there, Maui and Oahu. If you have something that you would like for us to share, let us know. And if you can get a hold of the owners of the business and they're willing to come on, and they have something that's very unique, let us know, because we love to bring them on. And we'll try to bring on my friend BG from the island of Kaho'olawe. He lives on Kaho'olawe. His name is BG. That stands for Billy Goat. We'll try to bring him on. But we'll try to bring on anybody and everybody. You folks can get to meet all the different businesses that have been affected by COVID. How's that, bro?
Well said. Well said. We have a request for you to stop rocking, because you're making some of these guys seasick.
Okay. How's this? Is it better now?
Yeah. And and Dr. T is coming in right now, but we'll also have a volunteer for Super Spy. Remember Super Spy on Checkers and Pogo?
Yes.
Troy Waliali has volunteered for that. And then someone is suggesting we do an audition for Professor Fun. But now I see Dr. T right there.
Hey,
Yes.
I think he might make a good Professor Fun. What do you think?
That bugger is a good-looking bugger, man. And you look at that guy, he's slick, man. And a lot of people on Kauai miss him from all the comments we had throughout the week promoting tonight.
yeah, I miss all of them. Patients and all my friends from Kauai.
Well,
Good.
Doc, I know you're a busy guy, and we appreciate so much that you're joining us tonight. Yeah, like Charlie said, you got a lot of patients here that miss you. You got a lot of fans here. You're a star now. You're on TV almost every night. I think I see your commercial every single night. I wish I was in Waikiki. I'd go see you. 10-minute waiting
That's
time. You got everything right there.
right there.
Damn. It's probably quicker for me to fly to Waikiki, go to your ER, get seen by a doctor, get my labs and x-rays all done before I could get into an ER here in Kauai.
Maybe. I hope it's not the case, but
Well, thank you, man.
and that urgent
you,
care is pretty busy.
I'm sorry.
That urgent care
Yeah.
in Kauai, they're doing a good job.
Well, I got to say, I've had many experiences here at Wilcox ER, urgent care, at the clinic, everywhere, and I got to say, I'm very proud of our medical resources here on Kauai. I gotta say, man, they've been awesome. So anyway, Doc, what we do is we do this every night. We bring people like yourself on to inform and educate our viewers. We're competing tonight with a candidate forum that's going on Facebook Live for the Kauai County Council. But we still have over 100 viewers right now live, which is pretty good. By the end of the day, you know, probably 1,000 or 2,000 people will see this. Again, we know that you have been very active in the testing and in the treatment and so forth. So we're going to turn it over to you, Doc. Give us an overview, and then as our viewers have questions, we'll have some time for that as well.
I'll be happy to answer. I'll be happy to give you kind of how things have evolved here in Oahu.
Go for it, bro.
All right. So from the onset of the coronavirus pandemic, we've been in a situation where we've had many difficulties. First off, we didn't know what we were dealing with. We didn't know what kind of virus this is, how lethal it would be, how easily it would infect other people. We didn't have any tools to diagnose it, nor did we have tools to treat it. So it was a very scary, and it still is a very scary time that we're dealing with this pandemic. And from the onset, my partner and I, Dr. Wu, at the Doctors of Waikiki, we're at the Princess Kaolani Hotel at the Sheraton Princess Kaolani. We were advocates for testing. As soon as we found means to test people, either local laboratories or laboratories outside of Hawaii, we started doing testing because we had no other tools and no other means to be able to diagnose people and to come up with ways to find out who's sick and to put them out of the healthy people so they don't infect other people. We were lucky. I think Hawaii in general, I think we dodged the bullet. I think shutting the, I wish they didn't have to, but I think shutting our borders early on helped so that we decreased our amount of patients. And I think that we're sick, and I think we can always keep on improving how we're dealing with the patients. But what else I want to say? I need some direction.
Okay. Well, I think let me ask you the very first question, because this is one that's floating out there, that it's becoming a reality. And that question is about opening up. Now, we know we've tried very, very hard to get pre-testing. That's still in the back burner. It's not a guarantee, because you know, like especially those visitors that fail to follow the quarantine rules. You know, we only have so much law enforcement that can go and enforce. Now we got all these contact traces coming on. But now when we talk about opening the floodgates, right now we got a manageable level coming in, but even at the level it's coming in now, it seems pretty hard. And if we're ramping up where maybe we might not get to the full capacity, but say half of it. What's your impression, or what's your idea? If, you know, it doesn't seem like we're gonna be able to test everybody, and we're just running the risk. I mean, what's your take on it?
Here's my take. I think there is a safe and effective way to test people before they come to our island. And I don't know what the legal aspects of that are, but currently, for example, before people go to American Samoa, before they go to Tahiti, before they go to Guam, they need to have a negative test within 72 hours of their flight. So they come to my clinic, I do the nose swab, I give them, within 2 days, I give them their results, and they fly on their way. Now, why can't we do the same thing? Why can't we expect tourists when they come here to do the same? That's nothing out of the usual. They can go to their doctor or find a clinic over in the mainland within 72 hours, make it part of their agenda. We want to go to Hawaii, this is what we have to do. We need to do this. Or we have to go under 14-day quarantine. Well, if I was going to go on for 14 days and stay in quarantine, I wouldn't go on vacation. So I think everybody would do the testing. But we need to stand firm and find a way that we can legally enforce, I guess, a way for people to get tested before they come to our island. And then that way we would have a little slice of heaven in all the world. We would be able to promote for tourism and say, we are the only place in the world you can come with a very low incident rate of corona. maybe even 0 cases would happen if we kept on testing everyone.
Right,
And then
right.
people would flock to Hawaii, and we would be back in a short period of time, all the tourists. But we need to test them. We need to do some kind of mandated. They need to have tests. If I can do it for all these people going to American Samoa, Philippines, for example, also, and to Guam and all these other countries, well, why can't they do it in the mainland? They can do it. And if they can't get it done, they don't come. That's simple.
You know, there's been questions about the pricing. You know, it's always about this thing. I know that the price, you know, the price point.
No.
What is the cost associated with this?
They have insurance. If they have insurance, all they have to, their only part of their fee would be their copay. If they go see their doctor in the mainland, they'd have copay to see the doctor. Then the doctor would order the test. If he can't do the test in his office, he would direct them to a lab to get the test. Currently, under the CARES Act, they're covering the cost. The United States is covering the cost of the testing. So in reality, it's practically anything. All it is just their copay to go see their doctor. So not an issue. If you have insurance, it's not an issue. Now, if you don't have insurance, then you have to see the physician, pay whatever fee it is to see him. And if the lab testing would probably between $50 and $80 for the PCR test, the nose swab.
Right.
And that would be the most effective way for us to screen all tourists coming to our island. And could some people slip through? Yeah, a little bit, but it'd be a very, very small percentage. And so that would give us this amazing opportunity to be a leader in Corona, like New Zealand. You know, look at New Zealand. We could be like New Zealand, but New Zealand's probably requesting people coming to their country. They're probably requesting people to get PCR testing. They're not saying, "Oh, come on, tourists." They're saying, "You guys got to get tested, then you can come to the country." So we need to stand. These are strange times. These are different kinds of times. I think they need to come up with a way to mandate testing before they come to our island. And then they can get tested again when they come here if they want, one more time, maybe before they go back to the United States, to the United States mainland. But the testing is getting more and more accessible. The testing is getting more and more available. I'm just in the process of purchasing a new test, which will give us, without sending the nose swab to the lab, I can give you results within half an hour in the office. So if I can find these things, they all are available. They're all over the world. You can buy them and use them. They're FDA, what they call emergency use authorized. So there is a way to make it safer, and there's a way for us to open up our island so that we can get the economy going again. You know, most of our economy is based on tourism, taxes, everything. We need the tourists, unless we can change to some other form of, monetizing the island and different kind of economy. But for now, it's tourism.
Okay.
Well, you know, for the last 3 months, I think Charlie and I and many people, in fact, everybody that I've heard, every medical personnel, every doctor, every nurse, everyone throughout this country, in fact, throughout the world, has focused on the importance of testing, whether it's for travel or it's just domestic testing, to see where you're at, your community is at, to get an accurate snapshot of the activity of the virus within your community. And, you know, since the beginning, and, you know, Doc, this is all unscripted, man. This is just purely, yeah. So I don't want to put anybody on the spot, but, you know, I'm going to ask the questions. From day one, our Department of Health has been very hesitant or apprehensive to test. They, you know, as recent as a couple of weeks ago, I really don't watch it anymore because it's frustrating, but the Department of Health has always made the statement that testing isn't, and in fact, I heard him say it, that testing doesn't do anything for us. The best thing we can do is social distance. Of course we know that, but this state hasn't tested enough, in my opinion.
No,
I know every other island has done a lot of testing. Kauai, and I just looked it up while Charlie was talking. As of today, since the beginning of time, since beginning of COVID, Kauai has performed 2,535 tests, which isn't that bad compared to the other counties, but still, the testing has not been done. I think to get a test, you got to have the virus pretty much.
Well,
You got to have all the symptoms, you know.
it used to be. They changed it. Finally, they relaxed on the. I was doing it if they had a good story. You know, from the beginning, we were testing not people that were just symptomatic, meaning they had traveled to a place that had a high incident rate of coronavirus, or their best friend or their wife or their somebody in their family was positive. So I tested them. They were not symptomatic, everybody I tested. And that's the scary thing. A lot of people don't have symptoms and they're positive. And another scary thing is that some people are still positive more than 2 weeks out. And so they might feel fine. They're not sick. They'll think nothing's wrong with them. And they're going to go out passing the virus to all these other people. And then the people eventually will lead to somebody who has, you know, health related problems and leads to possibly getting really sick. But I agree with you, Mel. The Department of Health had a very interesting stance on the onset of this coronavirus pandemic. And I think the reason was, one, I think they didn't have that many tests available. So we were limited at early on how many people we can test. And that's what I was told. So if that's the truth, then they had to be very selective in who they tested because they didn't have the ability to test everybody. But I think they were being really overly protective on testing. So I think they should have opened up a little bit because myself and a lot of physicians that were currently dealing with the coronavirus pandemic at that time during the initial outbreak, we were very frustrated. Like I told, a lot of times I've said this, we had people from Wuhan, China, that had came to the clinic and they were, one of the family members were sick, but they had been like over 2 weeks in Hawaii, okay? And so they were outside of that window, even though we swabbed them and we sent all that information to the Department of Health, they said, oh no, it's been over 2 weeks. We're not gonna test them, you know? And I said, how crazy. They should have tested them. I mean, they were directly from the highest region of infection that we knew. And that was not just my story. There's a lot of stories like that about people that should have been tested, but I can't put my finger on it because I don't know what the problem was. Maybe they didn't have enough tests. Maybe they were being very selective. And then you hear about all those other rumors that, oh, they didn't want to have an outbreak in Hawaii because they didn't want to disrupt what our main income is tourism. So truth is, but I think there was a definite problem and we were not prepared. I think not just Hawaii was not prepared, the whole United States was not prepared for something like this. And that was really surprised me the most, from not having enough masks, from not having enough PPE, gowns and other things that the physicians and nurses need, from not having the ability to kind of push forward and get things done quicker. You saw that whole problem with the CDC. CDC was supposed to be making test materials and they screwed it up. They delayed it for months because they didn't know what they were doing. In other words, somebody messed up. How is that acceptable? CDC is considered one of the centers of the world for disease, for infections. So if the CDC couldn't get a grip of this, that's so embarrassing. In my mind, I was really embarrassed because that delayed all of the United States' ability to test and screen and isolate those people that are sick.
Wow.
And go ahead.
So with what you witnessed, I don't know if you witnessed the protest this past week.
Yeah, nobody.
With all the social distancing that we've been asked to do, and because we don't have a vaccine, social distancing and taking proper precautions, it's proven to work. But it seems like somebody gave the word, okay, coronavirus is going to sleep now, so we can go and protest. What do you think the numbers will be if there should be an outbreak? What's your gauge?
Well, look, after Memorial Day, we've been having little outbreaks now. As you can see, 6, 9, all the numbers were growing where we were 0 to 1 for a while. Wait for about 2 weeks after this protest, we're going to have, again, 6, 10, maybe more. I mean, it's ridiculous. I understand and I feel for people and they want to speak their mind, but they could have practiced social distancing. I saw pictures of the protests. Nobody was practicing social distancing, and then I guess they didn't want to flare up the situation any worse. So the police didn't want to intervene. And that's my assumption because they could have, but who knows what would have happened. But the people should have should have understood this. And the problem is the age group of the people that were going to the protests weren't our age. They were, 20-year-olds, 18, 20-year-olds, under 30-year-olds. And they don't care.
Well, and Mel and I started to laugh when we saw the next day the governor is asking, could you please voluntarily isolate for the next 14 days because you were.
You should have said, don't protest. Or if you're going to protest, do it a smart way. But
yeah, that announcement should have come out before the protest and say, hey,
right.
if you guys are going to protest, practice social distancing or you will get arrested. I mean, that's, I hate, because Doc, all of us, I think, support the cause. I don't think there's anyone that I've spoken to that did not support the cause. But, we are all here in the middle of a pandemic. We are here, and as we see states, we see Texas, Arizona, the numbers are blowing out of the sky now after Memorial Day weekend. And of course, this protesting is just going to exponentially grow the numbers. Memorial Day weekend, a lot of people were out at the beaches and park, but yet, for the most part, they were practicing social distancing. They were somewhat separated at this protest. Kauai, we had over 1,000 people on Rice Street. I mean, right. I mean, it was like a parade, and I'm worried about it. And I know our viral load is low, and so that, thank God, our viral load is low. But nonetheless, every day we're getting hundreds of visitors coming in. And a good percentage of them are violating their quarantine. We know this. We know we're not getting them all. And I'm worried that in the next couple of weeks, as the numbers start jumping, we are opening things up. I just read today that on Kauai, we're going to open up the bars now on the 16th of June. And that's, I mean, nothing against bars, but people, they tend to be more relaxed in bars and forget about these things. So I'm really, really worried. And, I'm hoping, getting back to the testing part. And I know you said we've relaxed, and we have, but I can tell you there's people right here on this that'll be posting very shortly after I make this comment that are still being denied the testing because of whatever reason here on Kauai anyway. And we don't have private testing spots like they do on Oahu, like your office or Miskovich or all of these guys that are providing these private testing facilities. We don't have that here. We have the hospital. And if you don't get a referral from a doctor, you ain't getting a test. So I worry for our island. I worry for our people. And I just hope I really hope we get through this next 2 to 3 weeks, or in fact, a month, as visitors start coming, more and more visitors come every day. I hope we can keep these numbers and this viral load down.
I hope so too. I hear you, Mel. I think if they come up with some kind of protocol, like I talked about earlier, about screening the tourists, and we already have a low viral load on the island, and then we would have a pretty safe place to be during this whole pandemic, which is not going to go away. The pandemic is not going to go away. The coronavirus is going to be with us forever. And we don't know if there's even lifelong immunity. We have no idea. And I've been reports that some people have immunity, but it's only for maybe 3 to 6 months, and then they lose the immunity. So if that's the case, I don't know what's going to happen. So this is going to be something we're going to have to deal with, which is very difficult to imagine, because we deal with the flu already, right? And the flu is similar to this, and there's many people die from the flu. Many people get very sick from the flu, and there's a lot of other problems related to the flu. But more people, the lethality is a little bit higher for the coronavirus when you really get sick. And we think the infectivity rate's a little bit higher from the coronavirus. And so it's kind of like a souped up influenza, that can cause more damage, and it's here to stay. So how are we going to deal with this? Well, we're going to have to focus on, like we're trying to do, vaccines. We're going to have to focus on somehow coming up with medication that can treat, more effectively. Right now, we only have one choice, that ritonavir, and that decreases the amount of time they're sick, but it's not a best solution that we have. And I think we have to be more aware of our social distancing and things we'll have to do in the future to kind of protect ourselves. So let's say I'm a person that's older, I have some health issues, okay, and I need to go on with my life. What am I going to do? Well, I'll wear a mask. I'll avoid situations where there are going to be a lot of people. I can wear Like those shields I invented. You can wear those shields. I got one right here. You can wear these shields to protect your face and walk around with this. We have to do something different. It might be a way of life. We might have to come up with things that are going to have to be unusual for us now to think of, but maybe we'll have to do this. Certain people will have to take measures to protect themselves.
Hey, Doc, question. I saw a news bit that involved you, and that's what prompted me to give you a call. But,
Sure.
I saw can you explain to the viewers your approach with helping the frontline workers? You were giving them testing. And I
Yes.
just saw the medics, especially the medics on Oahu. Can you explain that program?
So early on, we had access to a unique way of testing the population on a massive scale. So we privately purchased these tests that can give you an antibody review through a drop of blood and results in 5 minutes. And we use this to screen the populations. And we were the first to do that on a massive scale. So we offered that to the first responders first, because that made the most sense. And we didn't charge them anything out of pocket. We didn't even take a copay. We just billed their insurance a low-level visit so that we can see them and we can help them. And they were so grateful. But out of that grew a statistic, which is very unusual, that we thought would be much higher. And that's why I think our viral load is very low here on the island. We had about 0.4% of the first responders, and not specifically all the first responders, some more than others, that had some antibodies. Other than that, hardly anybody had antibodies. And you would assume that the first responders would be the ones that had the disease somewhere in the past few months. Who we found was higher chance of having the antibodies were people that were in the medical field that dealt directly with secretions from the lungs, like pulmonary or respiratory therapists, or pulmonologists, or people who do intubations like anesthesiologists and ER docs. But they still didn't have that many people that had antibodies, but I'd say it was about 0.4%. And so that helped give them some confidence. And that's what they told me. They felt more confident now dealing with the general public, because they thought they were going to get sick no matter what. And so they did their best by protecting themselves, by wearing a mask, by wearing shields, by wearing protective gowns, and it was helping. But we were also lucky that we had a low viral amount of coronavirus here on the islands.
So what, at this point, some questions pertaining to that now. There's been all these different, opinions about the accuracy of the test.
Okay.
Well, what's been your experience as far as that antibody test?
I agree. So we were very cautious on which tests we purchased. So the test is 98% sensitive, 99% specific. So that means it's very, very accurate test. So if you've had the virus, it will show me antibodies. The only problem is sometimes a very small percentage, a 0.2% chance of showing that you maybe have antibodies, meaning a false positive. False positives aren't that bad, because if it's false positive, all that tells me is that you maybe have had the virus somewhere in the past, and then I can do some further testing to verify that. But I'm not putting you in any harm, So this is a really good test. I'm very pleased with the tests and the results that we've been having. Now, as time evolves, there's going to be more and more tests on the market. And of course, I'm going to be advocating to look out and look for more tests that are going to be faster, less expensive, and accurate. But these tests that we've been using are very accurate. I've been very pleased. I wouldn't have done that if I wasn't confident in my testing. That would have been shooting myself in the foot. So we made sure before we took that leap we took a leap of faith, but then we took a leap by testing everybody, and we were very confident. And our results, so Straub Hospital did a screening for all the employees of the hospital, all the first responders, all the people that work in the hospital. They did a venous, so they draw your blood and they do the same test, the antibody test. Well, we had the same results. Same amount of people, about 0.4% of the population had antibodies in this first responder group of people. So I'm very confident about it. Now, as time evolves, like I said, there'll be more testing that's going to come around and opportunities to purchase them. And I think we should all, as long as the FDA is giving them what they call emergency use authorization, they're credible tests. The FDA has a process to get new tests out there so that we can use them, because we don't have tests. That's the only problem we have. Every test that we've been using, every test in the United States and Hawaii, is what they call FDA, Emergency Use Authorized, EUA. And if it has an EUA, that means the FDA has reviewed the testing, reviewed the company, and they've given them the rights to use them in the United States. And they're emergency, because this is an emergency. We don't have any tests. So I'm in the process of purchasing, like I said, those antigen tests that you screen, and I can give you within 30 minutes the same results like the tests I'm sending to the lab. So we're gonna be launching that in the very near future, because I think that's gonna be a way to give people, instead of 2 days results, I give them the results within a half an hour. Much better. So I'll have the antibody testing, we'll be doing the antigen nose swab testing, and we do the venous blood testing. The venous blood testing takes a couple of days. But I'm an advocate for testing, and I'm not going to stop testing. We're going to find more ways to test, and we're going to get people tested, because they need to know, especially as we keep on evolving and opening up the island. Now, we're all worried that we're going to open the bars. We're going to open all the restaurants are open. People are going to be gathering more. Well, we even need to do more testing, even more than before, because we need to isolate those people that are ill. So what else we've been doing at Doctors of Waikiki, which is also very unique. Nobody else is doing this. We're doing coronavirus risk assessment and mitigation for businesses. So most businesses that are opening, the biggest fear they have is they don't want to be that business that opens and then all of a sudden their customers or their staff have coronavirus, and that's going to be the front page news. Because imagine you have a restaurant and that's the case. So what they are asking us to do, and we've been giving them guidelines how to do this, test all my staff and then tell us, are they at risk? Is anybody positive? Test their antibodies. We come up with all these different protocols on how to test people. We've tested about 12 local businesses so far, and the number keeps on growing. And we're going to continue to do that. And we've been reaching out, and it's usually by word of mouth. And they've been reaching out to us and asking us, can you help us? And we've been doing it. Construction sites, restaurants, private businesses, nursing homes, preschools. We've done this already, and I think the number is going to keep on growing.
Doc, I got a question. And like I said, I think everybody we've ever had on the show, and everyone is talking about the importance of testing. We know that. Now, when you do a test, because the other concern I have is about the numbers, about the reporting system that the state has. When you do a test, you do your own lab work at your facility?
Yes. And then, well, not everything. So when we do the antibody testing, our test kit, we do that internally. If I do the nose swab, which is the PCR test, we send that either to diagnostic labs or clinical labs. Same thing with the venous antibody testing. So, and then once we get a positive result, we notify the Department of Health, and then the Department of Health deals with that. We've had over 30 cases that we've diagnosed in the Doctors of Waikiki. I think the number is close to 40. And then we've done about 4,500 tests already in the general public, both antibody testing, PCR testing, and venous antibody testing. So we are really testing a lot of people, and we test people every day. Every day we're testing, and we're doing urgent care at the same time.
Okay, so that was my question, was all for the private testers. I know we had Dr. Miskovich on. He was on a couple of times, and in fact, there was a point in time where I think he was responsible for over 50% of the testing on Oahu. Just sheer volume. And I was always concerned: are all of the results from the private testing, were they being counted in the state's numbers? So it's all being tested by the same labs, diagnostic clinical labs.
Whenever we have a PCR that's been positive, or venous antibody test, it's from these labs that we've been using, all of us. And same thing with Miskovich. So we're all on the same page, but we've been doing privately, and he asked, but I think it's just going to be interesting to see why there's only so little people actually doing the testing. I think if I can do the testing, and if Dr. Miskovich can do the testing, but every clinic can do the testing. What's the big deal? It's not hard to do. And they recommend that we do asymptomatic now. You just do the nasal swab, and you be cautious. I wear a shield. That shield I showed you. I'll wear this. I'll wear a mask. I wear gloves. Wear a special gown, and I do the screening. and then I send it off, and in 2 days they have a result. That's not hard to do. Now, if somebody comes to our office that's sick, we have 2 rooms designated for people who are sick now, and they go to those rooms only because we don't know they could have corona, and we don't want them to get everybody sick. We practice social distancing in the office. If somebody's sick, we take them right away. We don't let them sit in the waiting room. We put them in the room, and then we get their information while they're in the room. We don't let them sit and wait like everyone else. So if I can do this, everybody can do this. You know, I'm just a doctor like everyone else. I don't have any special funding. I don't have any special relationship with anybody. I don't do anything different. I'm just innovative, me and my partner, Dr. Wu, and we're being really aggressive and trying to help the community and try to get a hold of this virus. I mean, the sooner we can help get everything on track, the sooner everything goes back to normal.
I'll never forget Dr. Miskovich's first visit on our show, and he said, and I was actually kind of surprised when he said that, you know, the state was saying there were limited tests, there were limited PPE, and there were limited, all these things were limited. And yet Dr. Miskovich said, you know, it was available, like you just said, you purchase your own tests.
Yeah.
Where, you know, and he said, I remember him saying this like it was yesterday. He said, the reality is it's available if you want to cough up the money. If you are waiting for the handouts from the federal government, then yeah, you don't have tests. And I actually found that to be true, that there were many tests available, but obviously you had to pay for it.
Yeah, you had to pay for it. You know, you had to take a risk and to, you know, like I have N95s, I have gowns, I have shields, I have everything we need in gloves because we paid for it. We went out and got aggressive about trying to find these things, and we found them. So because we needed them, because we didn't want to get sick. Nobody in my office got sick. None of us have had positive antibodies. None of us have got the illness, and we've dealt with so many people with coronavirus. It's amazing, but we have the equipment to protect ourselves. And so if I can do it, anybody can do it. You just have to make a commitment and do that. I agree with Dr. Miskovich 100%. I think they were available, just you had to be, you know, not waiting for someone to give it to you. You had to go out there and buy it.
So I want to go back to the blood, the finger prick test, because I know
Sure.
we had Miskovich was on, and
Yeah,
oh
I
man,
know.
yeah, you know, Misk, he's kind of animated, but anyway, the CNN article, you know, CNN came out and said that finger prick test, 50% accuracy. I heard what you said earlier. I'm assuming that when this came up, you had a lot of people making these types of tests, producing tests, and maybe not getting the FDA, whatever you call it, certification or whatever, emergency declaration or what. And I would assume that some of these tests are probably 50% accurate, but you pick the test that you know through your research is accurate. And this was interesting when you said you compared it with the Straub venous test, and your results were basically the same.
Yeah, basically the same. So of course, whenever there's a problem in the world, people take advantage, right? They take advantage of the people in their most dire need, which is horrible. It's a sin. And so all these people were selling any kind of tests, and people were buying them without any. They were not even credible. They were not even looking into how they were able to achieve these results that they were telling them. And so a lot of people got misled, and they bought bad tests. They really did. Whole countries were lied to. Like I think it was Italy bought these tests from, not Italy, or was it Spain? Some other country bought millions of these tests, and they were the wrong test. They were the wrong test. And so, yes, people get lied to and people get tricked. But I needed to be, my credibility was on the line. You know, it's a small, you know how it is. Hawaii, everybody knows you. And so if I would have done something that was shady, how am I going to live with myself? And I need to be in this community the rest of my life. I want to be respected. I want to be somebody that people look to as authority for medication and for treatment and for whatever in medicine. So I was very cautious. Both Dr. Wu and I were very cautious on how we approach this, because we should have been. We were trying to help people, and you don't want to help people with something wrong. So yes, and I know people have been very critical about the testing, but as I said, everybody's different. We were very lucky that we found the right company, and we were very diligent about it. If it wasn't the right company, even if I bought the tests, I would have threw them away. I wouldn't have used them. What was the point? I didn't embarrass. You know, that would just be the wrong message to put across.
So Doc, before I ask you this next question, I'm
Okay.
looking at a lot of people writing in wanting to know your office where you're located. So you're located in Princess Kaiolani Hotel.
Princess
And
Kaiolani, ground floor.
Are you taking new patients?
Yes.
Are you okay?
Every day,
So,
8 a.m. till midnight. Every day. We don't close holidays. Every day open.
8 a.m. to midnight.
Yes.
Okay, so you viewers out there, you got it straight from the doc. This is the Princess Kaiolani Hotel, ground level. Yeah, it's on Waikiki. And what's the street right in front of the hotel, Doc?
It's Kalakaua.
Uh-oh.
Uh-oh.
Oh, well, he'll be back. He'll be back. I think, I know we had a guest that was, I forget who it was, but when their phone rings, you take the call, it cuts off the stream. So I'm sure he'll be right back. But yeah, again, the message, it's weird, Charlie. It's weird. I don't care if it's doctors, it's nurses, it's lieutenant governors, it's everyone has been talking about the importance of testing. And I mean, again, you heard it again from someone who's been doing this from very early on. I remember seeing the article, I think I saw the article or the news coverage that this guy was taking walk-ins. You could just walk in and get your test done.
Mm-hmm.
And he's been doing this now for several months. Here he is again. He must have had a.
There you go.
All right, I'm back.
All right.
Well, I don't know what happened. Somebody shut everything off.
Oh.
Yeah. Did you get a call? Did a call come through or?
Yeah, a call came through, but because I'm using my phone, I didn't have time to.
That'll do it. That'll do it. But
sorry, guys. But
no, not a problem.
we're at Princess Kaiolani Hotel. Parking is validated if the garage is open. If the garage is not open because it's not open yet, you can just park for free in the behind the hotel. There's a parking area. It's about 8 cars. And every day we're open. It's myself and Dr. Wu, and we have 4 other doctors that work for us. And we have about 35 staff. So we're about 40 plus people. And we get it out quick because we've designed it that way. We have 8 exam rooms. We do minor procedures. If somebody's cut, they need to get stitches, we do that. We can set, if somebody's things, we do, if things are dislocated, we can set them back into place like your shoulder. We do x-rays. We do everything, IVs, you name it. We do everything we can, but on top of that, we do testing. We do testing because I think it's really important at this time. What else can you do? We have to come up with a way to screen the population and give people peace of mind. And we have to find a way to isolate these people so that they don't infect others. And if I can help, and Dr. Wu and I can help, we're going to keep on doing that.
So this debacle they had. I mean, I don't want to use the word debacle. I'll take that back. But there was, I guess, a misunderstanding with the test kits that the city and county of Honolulu was going to purchase, and then I don't know how much money they spent, and then next thing you know, the thing was offline again.
Yeah, I don't know what happened there, Charlie. I heard about something too, but I never got any details. So I don't know if those were antibody tests, were those PCR tests. I have no idea. If you maybe I don't know. I wanted to find out because I think that was something that if somebody, it doesn't matter if somebody messed up, they messed up. They didn't do it on purpose. Like I said, there's a lot of bad people out there trying to make a buck and selling things that just are not adequate. Like I was hearing a story the other day about people were trying to get those N95 masks, right? Well, they bought like 20,000 of them, and they're going to start giving them out to the hospitals. And every mask they tried on, the straps would break. They were just dry. They were just too old, But somebody bamboozled them. They knew that, and they bought them. And their intentions were good, but not the other people selling them, So there are people out there taking advantage always, and that's never going to stop. people just take advantage of people in their hardest times. And it was probably the same thing happened during the hurricane Iniki back in the day. Same thing probably happened. People took advantage of people. But it's a shame in general. That's what happens. Humans, we tend to, I don't know. I think I love everybody, but I think sometimes there's a small percentage of bad apples. They cause a lot.
It's called the opportunists. You know, they see an opportunity and that's it. You know, money before anything else, and that's the sad thing. And it unfortunately happens in every crisis. Every, you know, obviously anytime you get some kind of problem and hurricanes, it doesn't matter. You know, these guys surface, these scrubs. You know, I mean,
Yeah,
there's a special place in hell for all of them. I can tell you that.
I think so.
Congressman Case was on our show last week, Friday, and he talked about trying to get the U.S. Department of Health to pass some kind of requirement for people to get tested, but he wasn't going to wait. So Monday he introduced legislation at Congress
Okay.
to give the states the authorization to require testing. So you know that's in process. I don't know how long that'll take. So I'm hoping that we can get either the health department, the U.S. Health Department, to allow us that authority, or Congress will legislate it, and that'll be good for us, because our inter-island quarantine will be lifted on the 16th. I still think that I don't think we have the processes in place at the state level to make sure that connecting flights that get on an inter-island flight will be checked, and I'm hoping that they do. They claim they do, but we keep getting these guys getting arrested, so we know it's not working. We know it's not working.
It's a lot.
The other question, I'm going to put you on the spot. We got 15 minutes left, but I'm going to put you on the spot. What would it take to get you to Kauai to come do a clinic a day, 1 day, a 2 day clinic? What if I got you a facility? I got you diagnostic lab. Oh no, there it goes again. This one is intentional. Okay, I thought you intentionally cut us off. Anyway, let's say I got diagnostic labs to basically host you, and we get you a nice facility, and 1 day a week.
I'd love to come. I don't know if I come 1 day a week, but I know we can arrange to come down there and at least do testing or do some kind of clinic. We can do it. Yeah, I'd love to. Why would I?
Oh my God. No, because Dr. Miskovich won't come unless he gets invited by the mayor.
No, I don't need to be here. All I need is give me a place, and
I'll get you a place. Get you a place.
Everybody, and they all can line up and get tested all day. That's not a problem. Well, you listen.
You are on, man. You are on.
You tell me how we can do it, and I'll do it.
Okay. Well, there you go, man. I'm excited. I am freaking excited. Yep, that deserves a round of applause. No,
I thought it was under control. I thought they were doing testing and everything, but
no, we're doing testing, but there are a lot of people here on this island, including myself, who my daughter came from Oregon back several months ago.
Okay.
She got sick. My wife and I got sick. My daughter went back to Oregon. This is all right at the beginning.
Right.
My daughter went back to Oregon. She got a fever. She definitely had symptoms. She went to her doctor. Doctor didn't even give her a flu test, sent her home with a fever with some antibiotics. We were all exposed to her. I got sick. My wife got sick, but we never got tested. So, I
Right.
I'd go get an antibody test. I would. And if I had to pay for it, I'd pay for it. And a lot of people feel that way, but we just can't get it. It's not available here. And the Dr. Miskovich and our mayor has had the communication. They felt that they had adequate testing going on the island that didn't require additional resources or additional backup from Dr. Miskovich. But there are a lot of people here, and I can tell you right now, just looking at these comments and looking at the what do you call that stuff, emojis, a lot of these guys here will go get a test because they're concerned. A lot of these people had symptoms, but it wasn't enough. Before they relaxed the requirements, these people had symptoms and they weren't tested. Now we want to make sure if we can get the antibody test or whatever. But anyway, we'll definitely talk offline, Doc. I appreciate that.
Hey, Mel.
We'll make it happen. We'll make it happen.
help.
Mel,
Yes.
let's ask the doctors, because I think everybody's asking, Doc, can you tell us the procedure? Because people are asking, how much is it going to cost? What do we have to do? Because everybody is under the notion that you got to get a doctor's referral. That's why a lot of them don't go get tested.
Well,
So
think
what?
if I'm the doctor at the clinic, I'm doing the referral, right? You have to see a one-stop shop. We get it all done at one place, right? So we'll set it up like I have my clinic set up now in Waikiki. And what we do is, symptomatic or not, if you're symptomatic, we isolate you. For asymptomatic, the test should still be done. And then if we do the antibody test, it's just a prick on your finger, and we take a drop of blood, and in 5 minutes we give you results. And do you have, antibodies, IgG or IgM? If you're positive for antibodies, then we follow through with doing a PCR test, and we do a venous test also. So we do both. We'll do the venous test and the PCR test to confirm and make sure you're not infectious. And then we'll tell you while we wait for the results to wait for about 2 days and isolate yourself. But if you're negative, you're negative. That means you never had exposed to it. If you're not symptomatic, that's done with the testing. Now, insurance will pay for the visit. Just like you go to the doctor and you need to be seen, the insurance will pay for the visit. And if you have a copay, you have to pay a copay, and that's it. I only did the no copay when we did the initial, drive-through. We were trying to get, all the first responders. But that's all they have to do is pay their copay. What is it? $5, $10, $20, whatever it is. That's all. That's only their cost out of pocket.
Okay. Now, if they don't have insurance,
if they want to do the antibody testing, they don't have any insurance, I can do it for $40-some.
Okay. Okay, folks.
Yeah,
so you heard it, folks. Right on.
Well, we're gonna work on that. That's gonna be Charlie's and my next project. That's gonna be our next project. And I know I already spoke to DLS because we wanted to bring Dr. Miskovich down, and he wanted to come down, but again, the mayor didn't feel that we had the need. And so Miskovich came on and he said his trip. He said, hey, you don't need a doctor's paper, blah, blah, blah. And then the mayor came on shortly after that and said that you need the doctor's paper. So I called Miskovich and said, hey, Doc, you told me that you don't need a doctor's paper. The mayor said you told him that you do. He said, yeah, you do need a doctor's paper, but I'm the doctor. I signed the paper.
Yeah.
So I said, so cool. That is just so cool. So you'll hear from us, Doc.
Oh, no, I mean what I say. We can arrange. That's not a problem. My partner and I would love to come out and help. No worries.
We will. I will actually talk to my DLS contact right after this session tonight, and we'll start the process. And we'll find you a place. We'll get you a place where we can. You drive through, or you need a fixed location?
It depends on what you guys want us to do. We'll talk about it. If they want to do a drive, do it, because we did it many times and it's not hard to do. But we can do it in a fixed location also. But the drive-through is really easy. It's not hard to do because we're used to doing it, and we'll bring all the staff that we need and we'll get it done. We can do 200-300 people a day. That's not a problem.
Okay.
Music to my ears. New music to my ears.
Yeah.
Yes.
We'll figure it out. And we can plan it and we can go and do this. I have no issue at all doing this.
Right. We will see. I'm already getting a text right now with a possible location. So God bless you, Doc. Yeah, I'm serious, man. I got to tell you, Charlie and I and our viewers here are loyal visitors. I mean, visitors, sorry, have been banging this drum for a very long time. And we felt that, wow, everybody else is getting tested except us. Here on Kauai, we're not getting. And our numbers, yeah, we had the lowest numbers. Yeah, you get the lowest numbers, you get the lowest tests, you can get the lowest numbers. And so this is really good stuff. I'm excited. And we will, I mean, if you read, you have Facebook, Doc?
Yeah.
Yeah.
When you're done with this tonight, go to my page or Charlie's page and you'll see the comments. Read the comments, man. I'm telling you, it's good stuff. Good stuff.
Well, I'm happy to help, and I'm glad Charlie invited me and you to do this Facebook Live interview. I'd be happy to do this anytime you like. And we are going to do what I said. You tell me and we'll arrange it. We'll come out and do testing, whatever you want to do in Kauai.
Oh, thank you.
This is what is called a virtual kiss.
Thank you.
I'm excited. Now, Doc, now I understand why everybody miss you so much, man.
Hey, I never got kissed on the internet before, but thank you.
Yeah, that's the first time I kissed anybody on the internet, I gotta tell you. My wife is all pissed off now. She just slammed her phone and went in her room. Look at that. We got offers for help by so many people.
Oh, well, all right.
uh,
I'll everything we need. I'll bring the staff. I'll bring all the equipment we need, and I've got the expertise. No problem. We'll arrange it. We can do it.
Man, I told Charlie the other day, I said, you know what, man, I'm going to ask him online, and, I'm going to ask him straight up and blah, blah, blah. And awesome. Perfect. Well,
Yeah.
we're winding up. We know your time is valuable, and we don't want to keep you longer. But Doc, I mean, there's a lot of people watching this, and what words of advice, what can you tell our people, knowing what you know, knowing the experiences you've had, you've dealt with COVID patients, you've tested thousands of people. We have visitors coming in. We have just come off of Memorial Day weekend. We've come off of protesting with thousands and thousands and thousands of people in the streets. And I think everyone has said this, including the Department of Health, that we will see an uptick in numbers as we move forward. So what can you tell our people in preparation of that?
What I want to tell everybody that COVID's here to stay, and that we need to always be wary, that we need to be cautious and take precautions like everything else about when there's an emergency. So we need to wash our hands like we've been told. We need to wear masks when we're in the public. We need to avoid large crowds if we have health problems so that we don't get really sick. We can wear shields to protect our face so that we don't get anybody else sick or they don't get us sick. But this is not going to go away, and we need to deal with this. And we need to be humans, though. Still, we need to socialize. We still need to go out. We still need to do things, but we have to do it in a different way. We have to be careful about how we do things, and we have to be careful about our loved ones around us so that we don't get them sick, and they could get so sick that they could die. So we have to be cautious. That's all. Life will go on. I think things will get better. We're going to come up with ways. Mankind is very innovative, so I think we're going to come up with ways, like vaccinations, treatments, all that's going to happen. But it's not going to happen today. It's going to take some time. So up until then, we need to be cautious.
Right on.
Whew, chicken skin, man. What's up, Charles? I know you want to say something, buddy. Checkers,
Well,
you're the new Checkers. You're the new Checkers, buddy.
I'm the new checker. Well, I just like to say thank you so much, Doc, because not taking away anything from any of our other guests, because we know that there are difficulties, but someone said the key word here is commitment. You just have to have the commitment. You got to get the desire. You got to get the drive. You're very transparent in what you said tonight. So even someone who doesn't understand what's going on will know. They heard firsthand from you. And I think that's what we wanted. We were just looking for that small opening, just that small light coming through that tunnel to say, yes, it can be done. Because when you're told it cannot be done, then we're basically, and being an ex-cop like Mel, we're looking at a hostage situation. And I don't want nobody to be held hostage. I don't want it. I just want them to know that you're going to be okay and it's going to be done. And so now this is the first sign of relief that we're going to make it happen. We're going to make it happen.
Well, if I knew, I would have reached out to you, Charlie, and said, Charlie, can I come out and do testing? Now that you guys have told me that you have a problem, I'm more than happy to help. All that get arranged, we can do it. It's not difficult. It really isn't to do. So once we're done with this, we'll get online, or after tomorrow, or whatever, we'll get some discussions between us, and we'll figure out how we're going to do it. I have no problem.
Right on. Right on.
Oh, well, let me just say this. We've had, I don't know how many guests we've had on this show. We've had, I don't know, 30, 60, 90, close to 100 guests, I guess. We've been doing this every night since it started. And we did a t-shirt thing, and it's really like, this is one of the shirts that we sold on here. It's Don't Be a Doodle Boy. But we did 3 shirts. Kirk Correa, who's on, and our viewers know this, but I'll share with you and I'll get to the point, is we raised $6,200 for Hawaii Community Foundation selling these shirts. We did a check presentation on Monday, and the reporter asked me, Mel, what was your most memorable show? And I said, I honestly couldn't tell you. I mean, we've had Congress people, we've had the Lieutenant Governor, we've had the Senate President, we've had people from all over. We've had the Senate COVID committee on. We've had Dr. We've had we've had DOE, we've had representatives. We had so many people. Dr. O'Carroll was on just the other night. It was just amazing. and I said I really couldn't tell you what was the most memorable show. If she had asked me that tomorrow, I would say tonight was the most memorable show. And I'm not blowing smoke up your ass, Doc. That's the God's honest through truth.
Yep.
Because we have been fighting for this for a long time.
Sorry,
Long time.
I reached out, like I said, a long time ago. I had no idea. So I'm glad that.
Yeah, I know. I don't know why I never just called the freaking doctors of Waikiki. Jesus Christ.
Well, I reaching out to certain politicians and nobody returned my call. And I wanted to say I can come out and do testing and nobody returned my call. And I said, okay, so I guess they don't need me. But now that you guys have reached out to me and you asked, I have no problem. We're going to make it work, guys. I know we can do this. That's not a problem at all.
Well done. Man, I'll just say thank you very much on behalf of all our viewers. I mean, if I wish you could see all these emojis floating, hearts and everything, man. These guys are Sherry's saying there is finally a light at the end of the tunnel. I'm just read some real quick. Great discussion. This is awesome news. With the Memorial Day holiday gathering, recent protest, we need, thank you, Dr. T. Kauai needs to be true regardless, blah. I mean, it's just, it doesn't stop, Doc.
Well, that's
a lot of people offering their assistance, their location. So we'll talk. We'll talk definitely at your convenience. We'll get together. We'll make this happen soon.
Thank you, guys. That's wonderful. I'm glad if there's a need, we should help. And I think there is a need. I had no idea, but I'm happy to help. So let's get this set up. That's not going to be a problem. And I think we can do it pretty quick.
All right.
You see what's been happening, and I'll just be the one to say this, and I this is how Mel and I felt, because Kauai has had such a low caseload, a viral load. Yet we still see things popping up, and being and you worked up here before, Doc, but when you see that happening, we're here thinking it's sort of like that game where you have that mole popped up and you try to hit them on the head. You don't know when it's going to pop up. And so that's why we've been advocating about the testing. But they said, nah, it's always like, don't worry, we're in a good position. You say that for the people you have tested. What about people like us? And that's the problem. So now everybody's watching. We have that alternative. And when you talk about the accuracy rate of the testing itself, on the antibody testing, because you did your homework, right? We were just told a couple of weeks ago, the inaccuracy. And we can see, like you said, when there's all these companies putting out bogus stuff. But if you do your homework and you get the right thing, you're going to get an accurate test kit. And so hearing that, it's even much better. It's even much better.
Well, I'm happy that you guys reached out to me, and I'm happy that we can get some help to Kauai. So let's get this settled and get it done. I don't have any. All
right. I was going to read some comments, but I get emotional. I got to stop. Don't leave. The two of you don't leave. We're gonna share aloha, and then we'll I'm gonna just, Doc, if you don't mind, I'm gonna stop the Facebook feed, but then we can chat for about 5 minutes, okay?
Okay.
All right, guys. Hey, thank you all very much. Tomorrow night, oh man, tomorrow night we're going from the doctor to the union boss. Tomorrow night we get Eric Gill, and he has a message for all of you regarding the health and safety of the hotel employees and making sure that we keep our hotel employees safe as we get ready to open up. And then Friday we have Dr. Berriman from the Department of Health. She's the Kauai District officer for Department of Health. She's going to be with us on Friday. And on Saturday, we have Angela Keene from Hawaii Kapu Quarantine Busters. That one is going to be fun. So anyway, with that, everybody, you guys all take care. Stay safe. God bless. We love you guys. We will see you tomorrow night at 7. Aloha.